got a newbie. I love having my newbies on my show. I have with me Dr. Matthew Lynch, and he's the owner of Lynch Vein Aesthetics. Welcome to the show. What a great time for you to be on here because, yeah, it's a new year, it's a new you. You want to look good. But there's also really important reasons why people should do some of the things that you offer. So welcome to the show. Tell everybody a little bit about yourself and what you do.
Oh, thank you for having me. I am a general surgeon trained in Wisconsin and Cook County Hospital in Chicago. I've been in Phoenix for about 6 years, and I recently opened a vein and aesthetics practice in Peoria. The vein practice is very important to people because many people end up with varicose veins of one form or another that cause them a lot of problems throughout their lives.
I think people put those things in their heads in the sands with that too. Not just cremation and burial, but when you're dealing with like your veins, it could be something that you might want to take care of because aesthetically you may want to look nice, not have them. But there's other good reasons because sometimes people put that off and they don't know even that they have problems with their veins. I know that you're having an open house this Thursday that you wanted to talk about, and
Yeah.
I want to kind of let you talk about that. That's exciting for you. So tell everybody about what you're going to do for your open house.
Yeah, so the open house is going to focus on both aspects of the business, doing veins and aesthetic treatments. There will be raffles, giveaways, hopefully some gift bags, and just a chance to come and see what we do and where we're at. We've got a brand new beautiful office that we want to show off to everybody.
So that's going to be Thursday, January 14th from 5:30 to 8 p.m. They're located in Peoria. He does free consultations. Go up on their website and check him out. It's Lynch, Lynch, vein.com. Their phone number, it's easy. It's 480-800-8346, which is 800-VEIN. So it's really easy. And let's talk a little bit about veins now, what they are, and how somebody should know whether they've got a problem where they should come in and talk to you.
Absolutely. And you touched on something earlier. A lot of people think that varicose veins are just an appearance issue, when in actuality, a lot of varicose veins are problematic for patients. They're causing pain and swelling, inability to complete work or be able to sleep through the night. All of those things are reasons to have your veins checked out. There can be other more serious problems related to veins. They're rare, but if you're having progressive vein symptoms, you certainly need to have your legs checked out. Even if you think, oh, it doesn't bother me too much, it could be a sign of something more serious going on.
Don't wait till they're bulging out from the sides of the legs and stuff like that. That's not a good thing to do.
No, absolutely not. And not only is it waiting too long, but you have a very hard time of getting any of those veins to go back to normal and have any sort of normal appearance to your legs.
So how do they know? I mean, what's the first sign when you say that?
Well, the first thing you'll see is a lot of people start with spider veins, the little pink squiggly things on your legs, or the next step is reticular veins, where you have kind of the slightly larger bluish veins in your legs. They're not bulging and they may not hurt. But when you get to the point where you're having swelling in your legs, you have veins that you can feel, and if it's painful, they can itch, they can burn, you can get bleeding. Some of the worst bleeding I've ever seen as a surgeon is from a ruptured varicose vein because they just don't stop bleeding.
Wow, I can imagine. Now, let me ask you this. This is important. Does insurance cover the procedure?
It does. The way the process works is you come in and see me for a consultation, which is free, and then at that point we decide if you need to proceed to the next step, which would be an ultrasound to review how big your veins are and how badly the blood is flowing in the wrong direction. Insurance companies all have a different set of criteria for what they're going to cover. I've worked for United Healthcare for the last 2 years, so I'm very well versed in what insurance companies are looking for in this process. And if you meet certain criteria and your legs are hurting you enough to interfere with your life, your daily life, then your insurance company will cover it.
Now, most people think that varicose veins go with women. But it's not the case,
No.
is it? Let's talk about that, because let's say, you know what, the women are catalysts. So if you're sitting next to somebody right now and the man's got some, varicose veins things, symptoms going on, nudge him with your elbow and say, hey, you know what, honey, you got to call this guy. Go ahead.
No, absolutely. And I actually just saw a gentleman yesterday who his wife has been bugging him for many years to have his veins checked out. Luckily for him, they were, very minor and pretty typical for a man of his age. And he's going to come back and see me in a few months, and we're going to decide at that point if we need to proceed with an ultrasound. But at this point, he's doing well. But yeah, men get them all the time, and they. Again, I think it comes back to the idea that it's just a cosmetic thing. They're not focusing on the fact that it burns, it itches. They wake up at night. They can't do the things they want to do on a regular basis. Play with your kids, your grandkids, or participate in your favorite hobbies. If your veins are interfering with those things, that's certainly the time to come and see me.
Now the phone number to call, it's 480-800-8346, which is 800-VEIN. So it's really simple. And then the website is Lynch, Lynch, vein.com. They're located in Peoria. He does free consultations. I think it's really important. Have that conversation with them. Just have a consultation and find out how they can help. What's that step that you need to take? And if it's covered by your insurance, it really makes sense to just do it. And now, again, the open house is coming this Thursday. It's called the 14th.
Yes,
the
yeah.
14th. And that's from 5:30 to 8 p.m. You can check that. Is that information on your website too?
It should be. If not, I will make sure it is.
It's okay. You can just because you heard it from me, you can tell them that you're going in there, run in there and go check them out. Now, you also do aesthetics, and I want to talk a little bit about that. What kind of things are you offering there?
So we do a wide range of aesthetic treatments, a lot of laser skin treatments for brown spots, red spots, wrinkles, lines, and then we also do injectable things like Botox and fillers. Again, free consults, and everybody's a little bit different for what they want and need. And it's really a conversation that we have.
And I want people to understand that this is not a spa. You're not a medical spa. This is a doctor's office, and you said that it is a surgical medical clinic. This is
Absolutely.
what it is.
Yeah, and the surgery aspect of it, I think, is what kind of separates us from other similar aesthetic places. I'm a surgeon, and I'm very skilled at putting needles in places and using the technology to give you the results you need, whether it's treating your varicose veins or making you feel better about how you look.
And even varicose veins can be a little bit of the aesthetic part of things, because when they get their spider veins, right? A lot of women get them when they're younger. It doesn't mean that you're old to have varicose veins, does it?
No, not at all. And the spider veins and the reticular veins can be treated with sclerotherapy or laser treatments, each treatment is tailored to the patient, depending on what I think is going to be best for you, and kind of what the end result is.
What is the downtime when it comes to vein therapy?
So they're really, if we have to do what's called an endovenous laser ablation, which is the procedure we do for large varicose veins, there's really no downtime. You do have to wear compression stockings for about 2 weeks afterwards, because once the vein is treated, we need it to be compressed and stuck together so that it doesn't reopen. But you're back to your normal activities within a day or so. I mean, really, I can't imagine a scenario where you couldn't be back to what you normally do.
Here's the thing that you said before you came on the show. I was listening to you talk to somebody, that you love what you do because you have the happiest patients. Why is that?
Well, it's because varicose veins don't happen overnight. It's a long, kind of drawn-out process. Like, a lot of women develop them when they're pregnant, and then 20 years later they come and see me, and it's such a slow decline, you don't realize how bad things have gotten until it gets treated, and you're like, wow, you know what, my legs don't itch and burn, I can sleep through the night, but they look better, I feel better. It really impacts people's lives.
Right.
And until I started doing it, I didn't really understand that, but varicose veins can be really difficult to deal with in your daily life.
They can be very debilitating depending on how bad they are, and a lot of people put them off. I mean, it's the last thing that they think about is, and I also don't know if people realize that it is covered by insurance. I think that, and again, that all depends on what state they're in. Is that correct?
Right, exactly. Yeah, insurance companies don't want to cover your spider veins and your small, cosmetic things, but if you have real medical problems from your veins, absolutely they are covered.
And today you said too that it's so easy. It's an easy procedure.
It is. It's quick. We do the ultrasound to make sure that your veins are the appropriate size, and then I have that information, and I put a small needle into the vein, and then we slide a fiber optic laser fiber up the vein, heat it up from the inside, and
Voila!
The procedure literally, once I'm in the vein, takes 10 minutes.
And then there's basically no downtime. And to have to wear some stockings, for the compression stockings, which a lot of us should be using anyway.
Well, and this is the time of year in Arizona to be doing your veins, because who wants to be wearing thigh-high compression socks in August?
Well, the number's easy to remember. It's 800 Vein. You can also check him out on his website. It's Lynch, Lynch, vein.com. They're located in Peoria. He does free consultations. And this Thursday, on the 14th, he's having an open house. He's really excited about what he does because he makes his patients happy. And it's from 5:30 to 8 p.m. Again, check him out. It's on his website. It's lynchvein.com.